A ranula is a type of mucocele found on the floor of the mouth. Ranulas present as a swelling of connective tissue consisting of collected mucin from a ruptured salivary gland duct, which is usually caused by local trauma. The Latin rana means frog, and a ranula is so named because its appearance is sometimes compared to the frog's underbelly. That is a ranula. An oral ranula is a fluctuant swelling with a bluish translucent color that somewhat resembles the underbelly of a frog rana. If it is deeper, it does not have this bluish appearance. If it is large, 2 centimeters or more, it might hide the salivary gland and affect the location of the tongue. Most frequently, it stems from the sublingual salivary gland, but also may occur from the submandibular gland too. Though normally ranula is present above the mylohyoid muscle, if it is found deeper in the floor of the mouth, it can appear to have a normal color. A ranula below the mylohyoid muscle is referred to as a plunging ranula or a cervical ranula and produces swelling of the neck with or without swelling in the floor of the mouth. That is a plunging ranula located below the mylohyoid muscle. Ranulas may measure several centimeters in diameter and are usually larger than mucoceles. As a result, when ranulas are present, the tongue may be elevated. As with mucoceles, ranula may be subject to recurrent swellings with occasional rupturing of its contents. When pressed, they may not blanch. Ranulas may be asymptomatic, although they can fluctuate rapidly in size, shrinking and swelling, making most ranulas hard to detect. However, if it gets large enough, it may interfere with swallowing. Since the lesion is deep-seated one, the overlying mucosa is usually intact. The tongue may be elevated, and when it is large, it may hide the salivary gland. The swelling is not fixed and is non-painful unless it becomes secondarily infected. Histology. Microscopically, ranulas are cystic, saliva-filled distensions of salivary gland ducts on the floor of the mouth, alongside the tongue, and lack a true epithelium. Treatment of ranulas could involve either marsupialization or more often excision of both the gland and lesion. Ranulas are likely to recur if the sublingual gland or other gland causing them is not also removed with the lesion. There is little morbidity or mortality connected with the treatment. What is marsupialization? Marsupialization is a surgical technique of cutting a slit into a cyst and suturing the edges of the slit to form a continuous surface from the exterior surface to the interior of the cyst. Sutured in this fashion, the cyst remains open and can drain freely. This technique is used to treat a cyst when a single draining wound would not be effective and complete removal of the surrounding structure would not be desirable.